Yeah. So a new study reveals a concerning amount of behavioral health problems among attorney in the United States. Okay. So somewhere I got a clue that this particular paragraph is maybe about the behavioral health problems, okay, among attorneys in the United States. Okay. The most significant findings are the rates of hazardous, harmful, and potentially alcohol dependent drinking and high rates of depression and anxiety symptoms. Okay, now there is a this paragraph is basically talking about a study. Okay, and what is the study is revealing is that there is a concerning amount of health problems, okay, among attorneys in the United States. And what are those health problems? They are basically related to the hazardous, harmful, and potentially alcohol dependent drinking and high rates of depression and anxiety symptoms. Okay, the new study found that the positivity rate, so the positivity rate is actually the rate of depression, anxiety, or let's say the alcohol dependency here. Okay, so the study found that the positivity rate for the legal profession was reported to be almost double that of a broad, highly educated workforce screened positive on the same measure. Okay, and this particular problem was almost double, okay, double than the other highly educated workforce. Okay, so on and on, in case if I have to know, so maybe I know that the topic will be related to the behavioral health problems among attorneys. Okay, and what is the crux of this particular passage? That there is a new study, okay, which has found that the high rates of alcohol dependent drinking, okay, depression and anxiety are some symptoms which are quite common among attorneys. Okay, they are twice as prevalent as the other counterpart, which is the highly educated workforce. Okay, so not a very technical paragraph, but yeah, it is quite lengthy. That's what makes this paragraph slightly um, I would say it's not a kind of a not to be done paragraph because the questions are pretty simple, okay? But the length may be of some kind of a disadvantage to the students who don't like reading lengthy, okay? But otherwise, it was an easy read, okay? It also found interesting differences among attorneys at different stages of their careers, okay? So there is some kind of different differences among attorneys at different stages of their careers, okay? Previous research has demonstrated a positive association between the increased prevalence of problematic drinking and an increased amount of years spent in the profession. So there is some previous study, okay, which shows that there is a kind of a positive association, okay, between the problematic drinking. That is, as you spend more amount of time in the legal profession, the more you get tend towards drinking. Okay, levels of depression, anxiety, and stress among attorneys reported here are significant, with a sizable chunk experiencing mild or higher levels of depression, anxiety, and stress, respectively. Okay. So, in terms of career prevalence, a majority reported concerns with anxiety at some point in their career, and 46% reported concerns with depression. Okay. So, levels of depression, anxiety, and stress among attorneys reported here are significant, with a sizable chunk experiencing mild or higher level of depression, anxiety, and stress, respectively. Okay. So, I mean, when this particular study was conducted, okay, so there was some age group among the attorneys which reported the mild level of depression, anxiety, and stress. There was some age group which reported the higher level. Okay. So, in terms of career prevalence, a majority reported concerns with anxiety at some point in their career. Okay, but at some point in their career they have the anxiety issues. Okay, and 46% reported concerns with depression. Mental health concerns often co-occurs with alcohol use disorders. Okay, so mental health problems and the alcohol disorders go hand in hand. Okay, furthermore, these mental health problems manifested on similar trajectory to alcohol use disorders, in that they generally increase as both age and years in the field increase. Okay, so that generally increase as both years and age in the field increase. At the same time, those with depression, anxiety, and stress score within the normal range endure significantly fewer behaviors associated with the problem alcoholic use. Okay, so it's again kind of reiterating the facts which is being mentioned in the first paragraph. Okay, It is giving the additional study. Okay, they are showing that the research shows that the mental health concerns and the problem drinking, okay, they actually increased among attorneys as they age, okay, and as their years in the particular field increase. So this is basically what I would say as the crux or the main idea of this particular paragraph. Okay, so while some individuals may drink to cope with their psychological or emotional problems, okay, others may experience those same problems as a result of their drinking. So it's a kind of a vice versa. Okay, attorneys working in private firms. So now we see that the focus is actually shifting to the attorneys working in private firm, okay, experience some of the highest level of problematic alcohol use compared with other work environments, which may underscore a relationship between professional culture and drinking. Okay, so they may underscore a relationship between professional culture and drinking. Okay, but with the attorneys working in private firm, this problem is all the more significant. Okay, encouragingly, many of the same attorneys who seem to be at a risk for alcohol disorders are also those who should theoretically have the great access to and resources for therapy, treatment, and other support. Okay, so now the best part is that the attorneys who are majority of the attorneys who are actually at risk of this disorder, okay, they can actually seek the treatment, okay, because they have access to resources, therapy, treatment, and other support, whether through employer provided health plans or increased discipline. Sorry, I'm so sorry. Sorry. So, whether through employer provided health plans or increased personal financial needs, okay, attorneys in private firms could have more options for care at their disposal. However, in light of the pervasive fears surrounding their reputation that many identify as a barrier to treatment. Okay, now what this particular passage is saying, okay, so this passage is saying that this kind of a problem of depression, anxiety, mental health disorders, okay, so these are quite common with the private firms, okay, as to their counterparts, okay. Now the case is that they are the people who are lucky, okay. I mean, like, the lucky in the sense that they have great access to resources, therapy, treatment, and other support, okay. But still they don't go for it, okay, because they identify that in case if they go to any rehab centers or other thing, their reputation is at stake, okay. So, however, in the light of pervasive fear surrounding their reputation that many identify as a barrier to treatment, it is not at all clear that these individuals would avail themselves of the resources at their disposal while working in the competitive, high-stakes environment found in many private firms. Compared with other population, we find the significantly higher prevalence of problematic alcohol use among attorneys to be compelling and suggestive of the need for structured and professional specific interventions. Okay, now this is the author that is bringing his point into the consideration, okay, that as compared to the other populations, okay, we find the significantly higher prevalence of problematic alcohol, okay, use among attorneys to be compelling, okay, and the author suggests that what is the need of the hour is the structured and professional specific interventions. Okay, so basically on and all, okay, attorneys in private firm experience some of the highest level of alcohol use, okay, and they could have the greatest access to the resources for treatment, okay, but they not avail themselves of it because their reputation is at stake, okay. Then what is required, okay, then there is a need for a structured and professional specific interventions, okay. So the last paragraph, attorneys experience problematic drinking that is hazardous, harmful, or otherwise generally consistent with the alcohol disorders at a rate much higher than other populations. Okay, so almost kind of the same fact which is being reiterated again by the first paragraph. Okay, these levels of problematic drinking have a strong association with both personal and professional characteristics. Okay, depression, anxiety, and stress are also significant problem for this population and most notably associated with the same personal and professional characteristics. Okay, the data reported here contribute to the fund of knowledge related to the behavioral health concerns among practicing attorneys and serve to inform investments in lawyer assistant programs and an increase in the availability of attorney specific treatment. Okay, so you know that in the previous paragraph the author has focused upon the structured and professional specific interventions. Okay, so again the author is kind of repeating the same thought that what is required is to invest in lawyer assistant programs and increase in the availability of attorney specific treatments. Okay, greater education aimed at prevention is also indicated, along with public awareness campaign within the profession designed to overcome the pervasive stigma surrounding substance use disorders and mental health concerns. The confidential nature of lawyer assistance program should be widely publicized. Okay, so since the attorneys don't seek the treatment because their reputation is at stake, so now the author is again elaborating upon the structured and professional specific intervention, and he's saying what is required is to maintain the confidential nature of these kinds of assistance programs. Okay, so again, all in all, in case if I have to summarize this, I would say that problematic drinking and depression, anxiety, and stress are strongly associated with personal and professional characteristics. This was an important point here. Okay, and there is a need for prevention. Okay, education and awareness campaign to overcome the stigma surrounding the use disorders. Okay, sorry. Okay, substance use disorders and mental health concerns. Okay, so in case you have to summarize this passage, so I know this is about the behavioral health problems. Okay, so the first passage was talking about the behavioral health problems among attorneys in the United States. Then they say that as they age with their career, okay, and as the number of years spent in this particular field increase, this problem actually increased. Okay, now this is more prevalent in the private sector, and what is required is a structured and professional specific intervention. So this passage is all about. Let's directly hit to the questions. Okay, not a very difficult passage to comprehend. Okay, but yeah, of course it was a lengthy passage. Okay, so the passage is most likely an extract from. Now I would rate this question as a moderate question. Okay, because of the close options, I would say. Okay, so the passage is most likely an extract from. The correct answer is actually it is from a research paper. Okay, the reason is that because there is a lot of data, there is a lot of research. Okay, so the author states fact. Okay, he states fact, he tells about a study. Okay, then he analyzes them, he analyzes the study, he derives conclusions from them. Okay, point out problems in implementing the solutions. Okay, all at a significant length, which indicates that this is a kind of an, I would say, a kind of an investigation. Okay, yeah, I would say it is a report from an academic journal. Okay, and research papers are generally published in the journals and all that. Okay, so research paper makes more sense because it is talking more of a research, more of a study. Okay, more of a facts, more of a analyzing the data and reaching at the conclusions and then helping with the solutions. Okay, so research paper makes more sense. Okay, newspaper article is big no. Okay, because of the structure of the passage. Okay, now the structure of the passage does not lend support of it to be from a newspaper article. Okay, so in case if you're going to see a newspaper article, okay, what is the most common thing? Okay, the most common thing is a language. Okay, so in case if it is a newspaper article, okay, even if it is about the medical study or something, okay, you expect it to have a simpler language. Okay, less technical words. Okay, and generally that appeals more to the human aspect as a target audience. Okay, so this wasn't generally for the every human beings in concern. Okay, so this wasn't very general topic, this was a kind of a very specific topic which was actually meant for the attorney health. Okay, so a newspaper article is not a case, and the newspaper article is not that elaborative, which keeps on repeating the same ideas. Okay, so that is not one of the case. So the language is the one discouraging factor which does not make this option correct. Okay, the science journal, not at all. Okay, the science journal basically talk about the pure sciences. Okay, this was more of a kind of a psychology journal, I would say, or a sociological journal. Okay, science journal is a too general, I would say. Okay, a psychological journal would make more sense to it. Okay, social magazines are the again like a similar kind of a thing for the newspaper article. Okay, so social magazine, okay, the passage is too technical again to be in for a social magazine. Okay, now the magazine, you know, it is actually meant for a general readership. Okay, now this is more specific to the attorney. Why would I would read something which is related to not my career? Okay, and I wouldn't expect this kind of the passage in a social journal or sorry, social magazine. Okay, so the magazine is a bit no here. So the research paper, because it is focusing more of a data research and all that. So one makes it a correct answer. Okay. Now let's move to the second question. Which of the following, if false, would support the study? So in the previous quiz also, in case if I remember, there was a question which was framed in this line. Okay, so which of the following, if false, would support the study? Okay, so that means that maybe in its current form, it is contradicting the study. Okay, and to support the study, we have to do the opposite of it. So let's see. Okay, now while the alcohol dependent drinking was reported by 11.6% of highly educated workforce, the rate was 20.6% of attorneys. Okay, this cannot be the answer, because in case if we false it, this will going to go against the data which is given in the passage. Okay, so it is true in its current form. Okay, as per the passage. Okay, so it support the study. Okay, because see, there is a line, because the study also says that the problem related to alcohol or the behavioral problems, okay, among lawyer is double than that of others. See, the most significant findings, the study found that the positivity rate for the legal profession was reported to be almost double that of a broad, highly educated workforce screen positive on the same measure. Okay, and this option is also saying the same fact, which is true, and we have to say that in case if it is false. So this is not the answer. Okay, now among educated professionals with stress levels within the normal range, attorneys reported significantly lower alcohol dependent drinking. Now the attorneys have reported significantly lower alcohol dependent drinking. That is totally going against the main idea. Okay, so the entire main idea about the passage is the behavioral health problems among attorneys. Okay, that is maybe due to the alcohol dependent drinking. Okay, now this is as such is a incorrect. Okay, so in case if which of the following is false. Okay, so in case if it is false, that is attorneys reported significantly higher alcohol dependent drinking. Okay, then it will gonna support the study. So this is what our option is actually talking about. Okay, so it has to be false to support the study. Okay, and the problem some of you might encounter is with what is this among educated professionals with stress levels within the normal range. Okay, there's something about the stress level within the normal range is not mentioned. What is mentioned is a highly educated workforce screen positive on the same measure. Okay, but again, barring this particular line also, then the second part of the sentence will make it totally incorrect. Okay, now the prevalence of alcohol use disorders among attorneys with 3 to 5 years was less than among those with 6 to 10 years of experience. Okay, now this is directly given in the passage as such. Okay, and this is true. Okay, so there is something mentioned here. Okay, that however in the light of the pervasive no, this was on here. Yeah, furthermore, these mental health concerns manifested. Okay, manifested on a simple trajectory to alcohol use disorders, in that generally increase both age and years in the field increase, and this is kind of supporting it as it is. Okay, so it is true as it is. Okay, so in case if we're gonna false it, it will going to weaken the study, not support the study. Okay, a majority of legal professionals who reported alcohol dependent drinking were found to suffer from mental health disorders. Okay, so majority of legal professionals who reported alcohol dependent drinking were found to suffer from mental health disorders. Okay, so the author has mentioned about the mental health disorders a lot many times. Okay, and see, mental health concerns often co-occur with the alcohol use disorders. Okay, so it supports the idea that mental health problems, okay, it occurs with alcohol use. Okay, and see, there is something here. Attorneys experience problematic drinking that is hazardous, or otherwise generally they problematic drinking that is hazardous, or otherwise generally consistent with alcohol use at a rate much higher than these level of a problem drinking have a strong association with both personal and professional capacity. See, depression, anxiety, and stress are also significant problems for this population, and most notably associated with some personal and professional characteristics. The data reported here contribute to the fund of knowledge related to the behavioral health concerns. Okay, so now we can say, see again, behavioral health problems. Okay, significant potentially alcohol dependent drinking. Okay, so by this logic, this again option is correct, as it is that a majority of legal professionals who reported alcohol dependent drinking were found to suffer from mental health disorders because they often co-occur. Okay, so that is the reason that the correct answer to this question is option number 2. Okay, now all of the following, this was an easy question. Okay, so all of the following are cited as factors contributing to the behavioral health problems among attorneys except. Okay, so this is an except question. So alcohol dependent drinking, yes, of course, this is the correct answer. Okay, see, there is a thing. So while some individuals may drink to cope with their psychological or emotional problems, other may experience those problems as a result of their drinking. Okay, so we can say, and moreover, mental health concerns often co-occur with alcohol disorders. Okay, so they drink to cope up with psychological or emotional problems. Okay, others may experience those problems as a result of their drinking part. Okay, so we can say that this can be actually alcohol dependent drinking is a factor which is contributing to the behavioral health problem. Okay, see, a new study reveals a concerning amount of behavioral health problems among attorneys in the United States. The most significant findings are the rate of hazards, harmful and potential alcohol dependent drinking. Okay, so this ways we can say, okay, length of service and work culture, exactly. Okay, this is an except question, so one is not the correct answer. Length of service and work culture, absolutely correct. Okay, this is mentioned. Okay, it is stated here that furthermore, the mental health concerns manifested on a similar trajectory to alcohol use disorders. Okay, in that they generally increased. Okay, both as both age and years in the field increase. Okay, so this is, we can say that the length of service and a work culture contribute to the behavioral health problems among attorneys. Okay, the problem some of you must have faced is with the concept of a work culture. Okay, that how work culture contribute as a factor to the behavioral health problem. Okay, so we know of the length of the service, which is directly stated here in this passage. Okay, but what about the work culture? Okay, see, this can be inferred that the work culture also contribute to the behavioral health problem. No doubt that it wasn't significantly mentioned in the passage. Okay, but the passage does not mention it clearly. Okay, but we could say that the passage actually focuses on some of the particular professional. Okay, for example, they say that this kind of the problem is for private firms. Okay, experience some of the highest level of problematic alcohol use compared with other work environments. Okay, so which may underscore a relationship between professional culture and drinking. Okay, so from these kinds of a line, somewhat this can be inferred. Okay, not directly, but yeah, indirectly we can say that a work culture contribute in a behavioral health problems among attorneys. Okay, see, professional and this. Okay, whereas among practicing attorneys. Okay, so I would say this is actually would be a more kind of a thing. Okay, the work environments, there may be some other lines also in the passage. Okay, which can be said to it. Okay, now the lack of resources in therapy, nowhere it is cited that a lack of resources or therapy is a factor contributing to the behavioral health problems among attorney. Okay, they say, okay, that they don't avail. Okay, so however, in the light of pervasive fear surrounding their reputation that many identify as a barrier to treatment. Okay, so it is saying that encouragingly many of the same attorney who seem to at risk are those who should theoretically have the greatest access to and resources for therapy. Okay, however, in light of the pervasive fear surrounding their reputation that many identify it as a barrier to treatment. Okay, so lack of resources or therapy is not a factor contributing to the behavioral health problem. Okay, so that is the reason that 3 is actually the correct answer. Okay, now personal and professional stress, this is directly given in the paragraph 4. Okay, where they say that depression attorneys experience problematic drinking that is hazardous, harmful, or otherwise generally consistent with the alcohol use disorder at a rate much higher than the other population. These levels of problematic drinking have a strong association with both personal and professional characteristics. Okay, so we can say that depression, anxiety, and stress are also significant and most noticeably associated with the same personal and professional characteristics. The data reported here contribute to the fund of the knowledge related to behavior. So this was a factor which was given. So the third wasn't the reason. So the third is the answer, but this was an easy to go question. I hope you got it correct. Okay. So let's move to the question number 4. It can be inferred from paragraph 3. So it's a very specific question. We have to focus on a paragraph 3. Okay. That the prevalence of mental health problems among attorneys in private sector is most likely attributable to, okay. So the mental health problems is most likely associated with, okay, competitive high stake work environment, okay. So yeah, it mentions about the other work environments, okay, but see again, we cannot directly say that it is a cause of a mental health problem, okay. They are, let's say, in case if I'm going to read this particular passage, okay, we have to look for the option that is most likely attributable to. We can say that this could be one of the reason, okay, but anyhow, let's read this passage, okay, before answering to this question, okay. So while some individuals may drink to cope with their psychological or emotional problems, okay, so they drink to cope with their psychological or emotional problems, okay, and it's not necessary that the psychological and emotional problem is related to the competitive high stake work environment, okay. Others may experience those problems as a result of their drinking, okay. Others may face these kinds of mental health problems due to drinking, okay. Now, attorneys working in private firms experience some of the highest level of problematic alcohol use compared with other work environments, which may underscore a relationship between professional culture and drinking. Encouragingly, many of the same attorneys who seem to be at a risk of alcohol use disorders are also those who should theoretically have greatest access to and resources for therapy, treatment, and other support, whether through employer-provided health plans or increased personal finances means attorneys in private firms could have more options for care at their disposal. However, in light of the pervasive fear surrounding their reputation that many identify as a barrier to treatment, it is not at all clear that these individuals would avail themselves of the resources at their disposal while working in the competitive high stakes environment found in many private firms, okay. So what is being mentioned is that compared with other population, we find that significantly high prevalence of problematic alcohol use among attorneys to be compelling and suggestive for the need for the structural and professional specific intervention, okay. So no doubt that the competitive high stake work environment was mentioned in the prior third form, okay, in the third para, okay, but it wasn't the reason, okay, it wasn't the reason for the prevalence of a mental health problems, okay. It was a reason that why they don't actually go for the therapy, okay, when they have greatest access to resources, therapy, and treatment, okay, but why they don't go and take that particular treatment, because it is because they feel that their reputation is at a stake, because they are working in a competitive high stakes environment which is actually found in a private firms, okay. So but we cannot say that this is most likely to be the cause of a mental health problems, okay, somewhere, because it is says that drinking sometimes can cause the mental health problems, and sometimes because of a mental health problems you tend to go to drinking, okay. So this cannot be said to be the most likely, okay. Problematic alcohol use is actually the correct answer, okay. So while some individuals may drink to cope, okay, with their psychological or emotional problems, others may experience those same problems as a result of their drinking, okay. So mental health problems, we can say, okay, so psychological and emotional problems is somewhat related to the mental health problems. This can be inferred, okay. So we can say that the problematic alcohol use is the most likely, okay, because again, in case if we go with the entire main idea of the passage, okay, then again the passage is talking about the prevalence of a problematic drinking, okay, again potentially alcohol dependent drinking, okay, and then high rates of depression and anxiety symptoms, okay. Now, or attorneys experience problematic drinking, okay, and these levels of problematic drinking have a strong association. Depression, anxiety, and stress are also significant problems, okay. So we can say that somewhere overall, okay, the emphasis of the author is on the kind of the alcohol usage, okay. So that is the case. fear of losing their reputation if they seek therapy. Now, this is not the most likely contributable or attributable factor to the mental health problems. Okay, this is, they do not seek help. Okay, this is the reason. Okay, that why don't they seek for therapy or the treatment? Okay, lack of interest in therapy. Now, this is incorrect. Okay, this is inconclusive. This is incorrect. Nowhere in the passage it is mentioned that they lack interest in therapy. Okay, they don't take therapies, treatment, or other support because they feel that they work in a competitive high work environment. Their nature of job is such. Okay, so their reputation is actually at stake. Okay, so that is the reason that 3, 4, and 1 cannot be the answer. So the leftover option is actually the second option. Okay, now, which of the following, if true, most seriously weakens the conclusion of the study? Okay, now see, it is not about the opinion of the author. Okay, it is about the conclusion of the study, and we know that the study was actually mentioned here. Okay, so the study, where is my cursor? Okay, so the study was mentioned in the para 1. In fact, the para 2 was talking about the previous research, but not the study as such. Okay, so don't get confused with that aspect. So let's see what is the study says. A new study reveals a concerning amount of behavioral health problems among attorneys in the United States. The most significant findings are the rates of hazardous, harmful, and potentially alcohol dependent drinking and high rates of depression and anxiety symptoms. The study found that the positivity rate for the legal profession was reported to be almost double that of a broad, highly educated workforce screened positive at the same measure. Okay. So let's see this particular option. We have to weaken the conclusion of the study. Okay, attorneys do not disclose their identity owing to the fear of losing their reputation. Okay, but in case if the attorneys are not revealing their identity, okay, so does it make any kind of an influence to their study? Okay, disclosing or not disclosing, I don't think so that it is going to weaken the conclusion of the study. Okay, so maybe they do not disclose the study. Okay, they disclose their identity that I am this and this guy who's working in this and this firm. Okay, so maybe that is that particular identity is not revealed. Okay, so by identity here you don't mean that they're not disclosing that they are not attorney. Okay, they're not disclosing that which particular firm they are working with. Okay, so with what is their name and all that aspect. Okay, and moreover this is an incorrect option because there are many anonymous surveys, okay, that can produce the accurate results where identity is not actually necessary. Okay, so by that aspect this does not seriously weakens the conclusion. Okay, it is widely acknowledged that lawyers are generally liars. Okay, so maybe it is said that they lie in this. Okay, but again this is no impact. Okay, so it is kind of attacking the lawyer, okay, rather than the conclusion of the study. Okay, it is a popular belief, okay, or I would say this is a bias or a general statement which is open to exceptions. Okay, but I mean this is not directly related to the conclusions of the study. We have to weaken the conclusion of the study. Okay, now majority of the volunteers in the study fell short of a clinical diagnosis of alcohol abuse and other mental health disorders. Okay, now this is actually, you can say, this is directly weakening the study. Okay, why it is weakening the study? Because majority of the volunteers in the study fell short of a clinical diagnosis of alcohol abuse or other mental health disorders. Okay, so when the research was conducted, okay, these people do not have the problem of alcohol abuse and other mental health disorders. Okay, so when the problem that I am working on and this problem is not being encountered in my sample size, that will definitely gonna make my study or will going to make weaken the conclusion of the study. Okay, so among all people participants, they don't have serious problem. Okay, then these problems, then these study, I would say, okay, if most people in the study fall short of the disease on a clinical examination, okay, the problem exists only in that ways in the surveys. Okay, so that is the reason, okay, that makes the study altogether an inconclusive. Okay, now only half of the volunteers in the study were legal professionals with varying number of years of experience in the field. Okay, now only half of the volunteers in the study were legal professionals with varying number of years of experience in the field. Okay, now this is going with this particular thing. Okay, so the study found that the positivity rate for the legal professional was reported to be almost double that of a broad, highly educated workforce screen positive on the same way measure. Okay, so maybe half of the volunteers in the study were the legal and half of them were some highly educated workforce. Okay, so it is kind of going with the thought that half of the volunteer acted as a control group. Okay, which is the your highly educated workforce. Okay, and half of them were the volunteers. So that does not make much of the impact on the study. Okay, so which of the following, if true, most seriously weakens the conclusion of studies? Attorneys do not disclose their identity owing to the fear of losing their reputations. Perfectly fine. Anonymous surveys work. Okay, it is widely acknowledged that lawyers are generally liars. Okay, but we cannot say, okay, we cannot specifically say here, okay, that it is applicable to all the lawyers. Okay, this is a kind of a judgmental opinion which is open for discussion. Okay, open for exception. Okay, so there may be the lawyers that I have taken in the study, they are all quite honest. Okay, so we cannot say this thing. So this is majority of the volunteers in the study fell short of a clinical diagnosis of alcohol abuse and other mental health disorders. Okay, so when the majority of the people, okay, they fell short of a clinical diagnosis of alcohol abuse and other mental health disorders, how can I conclude that behavioral health problems among attorneys in the United States? Okay, so the most significant findings are the rate of hazardous, harmful, and potentially alcohol dependent rating and high rates of depression and anxiety symptoms. Okay, so I cannot conclude this thing in case if the majority of the volunteers are falling short of it. Okay, so that is going to weaken the conclusion of the study the most. Okay, so by this we are done with the RC. I hope you got most of your answers correct.